Hi there, thanks for visiting our page. I'm Dr. Peter Samuels of Samuels Dental Arts in Gettysburg. And I'm here with Dr. Julie Berger, who's a local Gettysburg denture specialist, to talk to you a little bit about the art and science behind denture treatment. If you're here, maybe it's because you're considering having your smile restored, or maybe you have a loved one who is in need of denture treatment. You know, there are a lot of misconceptions about dentures and denture treatment. There's a lot of confusion out there due to advertisements from corporate-owned dental chains and things like that. Did you know that there are dental specialists that are trained and board certified in denture treatment? I'm here with Dr. Julie Berger, who's a dentist and also a board certified prosthodontist. Dr. Berger, can you tell me a little bit about what you do?
Well, sure, Peter, and you're right. Most people have never heard of a prosthodontist. There are several dental specialties recognized by the American Dental Association, 9 to be exact. Most people know about oral surgeons and orthodontists, and some people have actually heard of periodontists who treat gum disease and pediatric dentists who treat kids, but not too many people have heard of a prosthodontist.
Well, what's a prosthodontist do?
Well, we have advanced training in treating patients who need dental reconstruction with removable dentures. We also have advanced training in restoring mouths with such things as dental implants and fixed crown and bridge work.
Well, can't any dentist do that kind of work?
Well, sure, any dentist is licensed to do anything, but most dentists don't have the same training as a prosthodontist. It's kind of like this. If you had a heart problem and you needed open heart surgery, would you go to your family doctor? Probably not. You would want to find a specialist, even though your family doctor is licensed to do it. You want to go to a specialist who has special training and the skill to do it right.
Well, that makes sense. Can you give me an idea of your training in making dentures?
Well, a dentist goes to dental school for 4 years, and when they get out, they have very little experience in making dentures. They've probably seen a handful of denture patients in school, and it's usually nothing very complicated. And I know this because I was a student and I am also a former dental school instructor. As a prosthodontist, I went on to do a 3-year full-time residency at the University of Maryland after dental school, and I also did a 1-year fellowship after that, and that's a lot of experience with dentures. It's at least twice as much as what most dentists get, and really, in my career and in my residency and as a student, I've made hundreds of dentures.
Hundreds of dentures. That's pretty impressive. Okay, well, let's pretend I'm someone who thinks they need dentures. Tell me why I should come to you. I mean, I see a lot of ads for dentures and denture clinics.
Well, for one, I have the experience and the expertise, and I guess I would say honesty to explain what you can and can't expect. I guess I would say that it's not really about the money. I love what I do and I love my specialty and I love helping to change the lives of my patients.
Well, what do you mean by honesty?
Well, as a prosthodontist, I get patients referred to me by other dentists, and unfortunately, I'm oftentimes in a position where I have to fix treatment that's not up to my standards.
Can you give me an example?
Well, I'd rather not go into details about that, but let's just say I see quite a few patients that if they had really come to me first, they would have saved a lot of time, a lot of headaches, and a lot of money in the end.
Well, a lot of clinics offer several types of dentures, like an economy denture and deluxe dentures. What are your thoughts about that?
Well, I don't really get it. To tell you the truth, it's kind of like anything else. You either do it right or you don't do it at all. I mean, if your surgeon offered you an economy bypass surgery, what would you think? I'd be terrified and I'd run. If you buy whatever they mean by economy denture, and you really can't chew or smile or function, then what have you really saved?
Yeah, I guess that's right. Do you think general dentists or clinics should have to tell folks that they aren't really specialists?
Well, that's a tough question to answer. I really just wish patients knew more about what a prosthodontist is and what we can offer, because we don't really advertise like clinics do.
Well, what do you do differently?
Well, mostly I take the time to do things right. Making dentures isn't like taking a few measurements and then ordering the parts from a factory in China. Every patient is different and unique, and that's why prosthodontics is really a great combination of art and science. I always start with a thorough head and neck exam, and really the shape of the head and the face and the amount of jawbone that's left is so important, and I cringe when I see people with teeth who look like they were made for someone else's face.
Yeah, I've seen that, and I know exactly what you mean. So what you're looking for is a natural look?
Well, yeah, that's right. Now, I will say that I can often make someone look, a considerable amount of years younger, but the teeth should not look artificial. It's never a cookie cutter approach.
I think you're being modest because I've seen some of your patients and they look 10 years younger. So how do you make people look younger?
Well, mostly it has nothing to do with the teeth. If the bite isn't quite right, the patient will have more wrinkles showing. So I use a special technique, and I take some time and I use my expertise, and oftentimes I can get a wrinkle-reducing denture. The teeth have to be the right length and the right size for each person's face. It's important to me to get the patient involved in the process also. I always go through a try-in appointment so the patient can really see what the final result will look like before the denture is finalized. And that way we can tweak things along the way to get it just right.
Okay, well, tell me, what's new in denture treatment?
Well, dental implants have really revolutionized the way we can make dentures and have them feel a lot better and a lot more secure for each patient.
Well, what can you do with implants that you couldn't do before?
Well, Peter, that's probably a whole other interview. But if you already wear dentures, you probably know that a lot of folks have problems keeping the lower denture in. And I'll also say that I always encourage people to keep their lower natural teeth for as long as possible. But if you don't have any lower teeth, and I can put 1 or 2 implants in, well, for most people it's a miracle. Suddenly, patients can stand on their heads if they wanted to, and the lower denture will stay in. They can eat healthy foods again and smile and meet people and go out without having to worry. And it really does change lives.
Okay, who puts dental implants in?
Well, that's part of my training also. I can place and restore implants, so you don't have to go to a lot of different places.
Well, Dr. Berger, it's been a pleasure talking with you. What would you suggest to someone considering dentures?
Well, really, I'd say do your research. You have to go to someone who's a real denture specialist. Get it done right the first time, and don't just fall for advertising. It's really your body, and you deserve the best treatment possible.
Thanks, Julie. It's been a pleasure talking with you. Again, Dr. Julie Berger is a dentist and prosthodontist denture specialist at Samuel's Dental Arts PC here in Gettysburg. She'd love to talk with you or give you a second opinion just to let you know the most modern and up-to-date options for dentures in Gettysburg.